The key thing is for her to see her doctor, and then the doctor would evaluate her to be sure that there is no other reason why she may be having the hypertension. And the blood pressure, she said,
137 over 90 or something.
Is still slightly elevated, especially the diastolic. So I think what she needs to do is to see her doctor, and then the doctor will look at her again, evaluate the medicine that she's taking, and look at the trend in the blood pressure. Also, her weight needs to also be looked at, and then her diet, if she's taking a lot of salt. There's some behavioral modifications and some dietary changes that she may need to do. It's something
we don't have too much time left. I need for you to tell us what we can do to prevent structural heart disease and holes in the heart.
First of all, let's look at the risk factors. The risk factors for a child, let's say, a mother that is diabetic needs to have the blood sugar controlled, very well controlled. So the first thing is you have to have a visit your doctor 3 months before you get pregnant, so that your risk will be evaluated. And then every child in Nigeria needs to have MMR, rubella vaccine.
Let's quickly take Joel on the line, our last call for today. Hello, Joel.
Hello, good morning, good afternoon, sorry.
Good afternoon, Joel. What's your question?
Yes, it's really delightful to watch this, your program.
Thank you so much.
I'm really excited for the health tips you are giving out.
Thank you.
And it's really eye-opening for some parents because we always go to the hospital and they give us hospitals or some drugs on general health cases when...
Do you have a question, Joel? Because we're running out of time. If you have a question, let's treat that quickly.
Yes, what I want to find out is that my son always have a cough all the time. Yes, always have a cough all the time, and I want to know if I can have some health tips for that. Without,
how is his weight? Is it growing okay?
Okay, so just go on and tell him what he needs to know.
Okay, if your child is having cough all the time, in our environment, commonly we see allergic cough. You know, some families that have reactive airway diseases, and then some have asthma. It may just be rhinitis. You know,
so
they're
he needs
sneezing
to
a lot.
Evaluate the cough.
Yeah, the child needs to
go
go
to the hospital
to see a doctor to see why is the child having cough all the time. If it's structural heart disease, the cough will usually come with fast breathing. It will be a lower respiratory infection. It will not be an upper respiratory infection. So if the doctor says that this is an upper respiratory infection, like having rhinitis or some things in the nose trees or in the throat, then that's not likely to be from the heart. Okay. But if the cough is from pneumonia and the child is having lower respiratory infection, cough from that, and it's not asthma, the child needs to be evaluated for structural heart disease.
All right, so just in 30 seconds, can you tell us what we need to expose our children to help them? For example, I heard that a good diet is fine. What else do we need?
Let me just say that for our children, first of all, we shouldn't be taking just all kinds of medicines. There are some medicines that are implicated in causing children to have structural heart defect.
Okay.
So mothers that are pregnant should not, or even mothers in reproductive age, if you're suspecting that you may be pregnant, you should not take just any medicine, because the heart is formed even before you know it, that you're pregnant. Sometimes you don't even know you're pregnant and the heart has been completely formed. So we need to make sure that we don't take all forms of medicines that are not prescribed. That's the first thing. And then some of the herbal concoctions we take contain things that may be injurious to the child, the unborn child. Alcohol is also very important. Is implicated in formation as a causative factor for structural heart disease in children. Many of the common heart problems in children can be from alcohol consumption by a pregnant mother. So, but then what can we do for our children, especially now, because our environment, people are improving. There's some increasing industrialization, so we are moving from communicable disease to non-communicable. So we're having a lot of structural heart problems now. I mean, a lot of acquired heart problems, sorry.
We'll have to close now. Yeah. Thank you so much. I know we could go on for another 30 minutes, but that was really good.
Yeah.
Thank you so much for being with us on the show. It's been wonderful having you and wonderful having your questions and your calls. Do have a great day. I am Mary Alale Yusuf.